Holiday time means family dinners, and that presents an opportunity to talk about family health history.
Yeah, if you don't know what to ask, how to bring it up, what's the important stuff, Courtney is here with us this morning with an expert who does know all of that.
Indeed. We've got Dr. Chris Stokes with us with Kaiser Permanente, talking about the different things that you should know about your family history, but also ways that you can bring it up, right? Because it's a good time. You're going to be sitting around the table anyway. If, for example, I say, can you pass me the mashed potatoes with extra butter? Is that a good time for some of their family members to say, should you eat that extra butter?
Yeah, that's a great angle. That's a good idea. It is an important part of, medical history. It's something that we as physicians should be asking our patients all the time.
Sure.
Hard to get sometimes because you ask a patient, tell me about your family. They don't know.
Yeah.
Right? And so this is a good opportunity to maybe ask those questions. It might be a little bit more difficult in some of our older generations. I remember my grandparents didn't really want to divulge a lot of their medical problems as much, but younger generations have become less inclined to not be so reclusive about that stuff. So it is a good opportunity to ask questions and talk about how it's important.
Okay, I want to show some of the things that are important to know about what the family history. For example, heart disease, diabetes, high blood pressure. All of those things are crucial to, your health history as well as what maybe your kids might even be subjected to.
Definitely. Cancers are another one. There's a lot of different cancers that are very genetically predisposed. Breast cancer, colon cancer, prostate cancer are just a few of the really important ones. They're very prominent regardless of whether you're at risk from your family history, but even having family history of this can put you at even higher risk and may actually change the way you should be screened. So it's very important.
And that's an important thing too, is screenings and knowing, what kinds of things you should be looking out for. For example, it might be general knowledge that you should go get a breast exam at the age of 40, but if you've got family history, you should go earlier, right?
Definitely. There's many cancers that we look at, but particularly breast cancer is one, colon cancer is another one, prostate cancer, like I mentioned. If you have, depending on the family history, you and your doctor may need to talk about, does this mean I should start early screening? And if so, is it just me, or is it other members of my family that need to have early screening? And when should I start screening?
So the CDC has a really cool tool that you guys kind of like. If you're able to kind of plug in some information and kind of take the worksheet, if you will, with you to family dinner.
It's really cool. It's really easy. You can just go in and start filling out kind of like your family health tree, history tree, and you can do it several ways. You can get as many people on there as you can, but really the most important people for you as a patient or me as a patient are my siblings, my blood siblings, my parents, and my grandparents, my blood grandparents. Anything beyond that is kind of gravy, since we're talking about Thanksgiving.
That's good, Dr. Stokes.
It's kind of gravy. But those people, first-degree relatives and your grandparents, are really the ones that are really important. So getting that information down and getting it to your doctor however you want. If you want to bring it in at your routine checkup, if you want to bring it in when you got a cold, I can totally take that and update your medical history and kind of review it. Nowadays, with all of our electronic portals and secure messaging, I would just tell patients, fill that out and send it to me, and I will update and I will follow up with you if we need to start doing something different.
I dig it. If you want to get your hands on that worksheet, we're going to link that as well as information for Kaiser Permanente to our website, gooddaysacramento.com, under show info and today's date. Dr. Stokes, great information. Thank you. All right.
Thank you for having me.
Guys, back to you.
It's funny, they don't offer up the family history information, but they'll tell you about how their elbow hurts for 30 minutes.